Hello. Hi. Congratulations on being a new mom. I am sure being so stressful, it is a quite hustle bustle going all around. You're still figuring out what to do, what not to do. And yes, still giving your 110% because you want to give your child the best of things. So friends, today's video we are dedicating to our little Nachikans, our little cute babies. We are going to give them a good oral hygiene so they do not suffer from oral cavities or tooth decays or do not have any kind of oral issues. Yes? Right? So come, let us have a look at today's video in which we are going to speak about 0 to 6 months oral hygiene care. Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, today we are going to speak about oral hygiene for 0 to 6 months. So mothers, you are already juggling between feeding issues, your hunger, your proper good health, and I'm sure you all have been sleep deprived. So handling all this, managing all this, you are now in the search of giving good health to your baby. You're searching already about weight gain, what to give, what not to give, when to start the medicines, when not to start the medicines. And here you are, landing up on a right video where you find a great and a good oral hygiene care tips for this little baby. So friends, let us begin by 0 month, where you have just been discharged from your hospital. Now you have quite been settled after a week or 10 days. You have been settled in your routine. You know that when your baby quite a lot gets up, sleeps, what is his feeding time, you have started getting those cues and clues which given by your baby. Now let us step into the next thing. I would say first 10 days, I agree that you have been struggling a lot, so let us leave that 10 days. From the 11th day, you must be on your toes because your baby needs this care. So what it is? Tip number 1 is, and it is very much important, that whenever you're feeding your baby, what you should do is clean all the gums, the mouth and the tongue. Is it really required? My baby has not got any teeth. How is the decay going to start? So friends, remember, at the 6 months when you are pregnant, that time only the baby's tooth development has started taking place. Also, the stickiness of your feeding causes a lot of layering on the gums. That can in future cause darkening of the gums. Also, the teeth can have white coating because of this sticky milk layering. So, you should remember cleaning the baby's mouth and the lips after every feed is very much important. Now the question arises that, how can I do that? After every feed? Oh my god, my lactation consultant has told me to lie down after every feed, to burp the baby. Also in between this the baby poops and does pee-pee. You have a caretaker, right? So, I have a solution for this. After you feed, give your baby to the caretaker. The first thing that you do is burp the baby. The next thing that you do is take a clean cloth, dip it in some hot water, warm water, and clean the baby's mouth and lips. Till that time, the mother is resting. The caretaker, whosoever XYZ person, has to do this for the mother. At least for the initial 1 to 2 months. This procedure has to go on till the mother gets settled. If there is no caretaker, then you mothers have to be a little on toes and take care that you are doing this. Because, as I told you, what are the reasons? If you have heard your grandmom's tales also, they say that wiping of lips is very much important because that pink baby lips turn dark. Now, the next thing that you should be taking care of in this 6 months is candidiasis. Yes, it is a fungal infection which is found in small babies, which can be because of closing of dryness, closing of mouth too long, or not cleaning up the tongue properly. Now you don't have to take a tongue cleaner and scrape the baby's tongue, but just as I said, a wet cloth or a wet gauze piece dipped in some warm water and cleaning it. The next thing that you are supposed to observe and not to get worried about is the rashes around the teeth. So these rashes are usually seen when the baby starts speaking, putting everything in the mouth and blah 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 bling, and yes, around the teething stage. So that is around 4 to 5 months, 6 months. This stage will start when the baby starts producing more saliva. Yes, the saliva which gets accumulated or stays around your face causes small pink rashes around the face. Sometimes if the saliva is flowing down through the nose, through the eyes, then there also these rashes can be produced. But make sure that these rashes do not have any pus, no strong redness, no inflammation around. They are just small dots which are seen. They can be white or they can be pinkish, but not red, not pus filled. So if you are seeing something other than white or red, or if there is something which is abnormal that you are finding, then make sure you visit your pediatrician and check on if there is not something different rash that is coming up. But if it is this rash, make sure just you clean that area up, keep it dry, and yes, Vaseline can help, that is petroleum jelly can help to avoid this rashes. So after you give your babies a bath, make sure in this area you apply a good amount of petroleum jelly, that is Vaseline. That will soothe the babies and avoid the saliva from being accumulated because of the wax layer formed up, and the rashes won't come. The next thing that you should observe in this first 6 months is natal and neonatal teeth. That is the teeth which occur before 6 months of age. These are mostly nothing but fibrous tissue which is present. It can sometimes hurt the feeding mother because the breast might get impinged or bitten up by this teeth. So it is nothing but adjusted tissue and it needs to be removed. Now friends, many of my clients or patients come up saying, at this tender age, should I remove my baby's teeth? Friends, it is not that tough. Even we care for your babies, right? So it is just going to be a matter of 5 to 10 minutes work and the job will be done. Your baby would completely have this procedure, a painless procedure, and the mommies will be relieved because their breastfeeding would be quite well. So if you are having any of such teeth which have occurred before 6 months of age, then make sure that you are visiting your dentist and getting that small piece of pinky pointy thing out from your baby's mouth. Then the next thing that you can observe is the gums, the tongue and the palate inside is not having any redness, any white patches or anything of which is abnormal. Then you can also observe for tongue tie at around 5 to 6 months of age when the baby starts speaking, or the position of the tongue. So this position of the tongue, the frenum, as you can see in the picture, it has to be free so that the tongue moves. If it is not, then approaching your dentist, finding the right age and getting the surgery done would be of greater help. Okay, so friends, this 0 to 6 months of age is going to be very sweet and very cute. I know it is a difficult, stressful, plus a wonderful and joyful journey for the new mothers. And to help you out, I am here, Dr. Mansi Shah, always. So if you have any questions related to this age group, then you can please mention it down here and I will definitely answer it to you. Now friends, in the next part, we are going to see 6 to 18 months of age, what care should you take and how should you progress with maintaining that oral hygiene. So, if you are a mommy of 6 months, elder child also, then definitely watch that video. And it is going to be posted next Monday. I am sharing the link here. I am Dr. Mansi Shah, a practicing dentist in city of Pune, state of Maharashtra. If you have any queries related to your oral health, feel free to ask me and I'm sure I'll get back to you. If you're liking my videos, make sure you give a like. If you're finding it useful and want to share it with your friends, press the share button. And make sure that you subscribe to the channel because every Monday and Thursday I keep on posting videos for you, my friends. So subscribe to the channel and spread some love. Wishing you all a very happy and a healthy smile. Stay healthy, stay happy, stay oral fit. Thank you.